situations change. So don't just assume that, hey, I've got to wait until they retire and that's when I'm going to be able to cross that Medicare bridge with them. Circumstances can change, something could change in 6 months or over the next year. So you want to make sure to let them know that, because if you don't tell them, if you leave that out of the conversation and say, then it could be a missed opportunity. You want to say, look, when open enrollment comes around, if those prices go up, or if the benefits are changing to where it's just you've got this outrageous deductible, then let's sit down, let's have a conversation again. Because
like Medicare Advantage is a very, very strong option, and still you'll see doctors that are encouraging people not to get on these plans. And I think that there's more to it. In a lot of times it's extra work for those doctors. So if you're a primary care doctor, then you have to have someone full-time who's doing referrals, because otherwise they take forever. If you're a specialist, sometimes you're frustrated because you're waiting for them. And then sometimes we were talking to someone earlier today who works in billing for one of the hospital groups, and he's like, oh man, it's cumbersome. It's like, they have so many stops in place to not pay, and it's frustrating, and you have to jump through this hoop and that hoop to get to it. So I do think that there is some truth to it. It's not just like, oh, we just don't like Advantage plans. So
yeah, what you don't want to do is say, no, you don't qualify for that benefit, so don't worry about it. Just throw that in the trash. Yeah. Or don't call that number. Yeah. That's still going to kind of leave them with that itch of, well, I want to know. And I wasn't really happy with the answer that my agent gave me. So take the time to have that conversation, to re-explain, even though you may have already explained it. And like you said, open up a conversation, ask some questions, and see if maybe now they do qualify. And so that way you've done your due diligence.
Welcome back to Medicare Agent IQ. I am Raul Gonzalez.
And I'm Oscar Ibieta.
And we're going to continue on with the episode that we did last week, which is what's the move?
Yeah.
Right? Yeah, I got it. I was like trying to make sure that I remember from last week. But yeah, what's the move? And really what we're trying to do is just kind of, we're honestly, this is more like Medicare training, right? Like just like things that pop up, things that will come up and in conversations. And a lot of times you can only get that from experience. It's very difficult to train to that. So it's like the more questions that we can answer, more situations that we can kind of put ourselves into, then agents are out there are prepared.
Yeah, and a lot of the questions that we're pulling here, these are real scenarios that our agents are running into while they're out in the field. And so that's what we're gonna take some of those questions and scenarios that we've helped some of our agents work through and really just open up that discussion with you. And like you said, it's not some of this stuff, a lot of what we're gonna be covering, what we covered last week and this week, these are really, there's no PowerPoint that you can really put together and work through. It's more of like a discussion that you want to have. I mean, sure, you can put the question up on a PowerPoint, but how would you answer it? How would you navigate through that question and have that conversation with an individual? And I feel like this is the perfect platform to be able to get some training on that.
For sure. So kind of the first question I wanted to run through is if you're a client who just turned 65 and you're still working, you have health insurance through your employer, but you're unsure if you should enroll in Medicare now or if you should wait, what's the move?
So initially my response is, well, let's have a conversation and figure out what's going to make the most sense for you. Because I know I really want to dive deep into this one, because sometimes people have already gone to Social Security and they've asked Social Security, and Social Security might say to them, well, you've got insurance through your work, then you don't need to apply for Medicare. And I'm not a big fan of that, because that person at Social Security who gave them that information could be misinforming them, because they don't understand, they don't know what the cost of their of their health insurance may be through their work, or what their deductibles look like, or what their co-insurances look like, or even what their health status may be, where they may be in a situation where they're having to use their health insurance quite a bit. It might actually make sense for that person to go ahead and take Medicare. But if somebody at the Social Security office tells you, well, you've got it through your work, you don't need it, and not a fan of that, especially for another reason for that is because your client, your prospect may be thinking, well, Social Security says I don't need it. what do you have to say about that?
Yeah, I wish there was a message I could get across to people that says something like, don't get your medical insurance advice from Social Security or from your doctor. just talk to an insurance professional, right? Because a lot of times they are giving them bad advice. So
yeah, but again, this person that we're dealing with, they're still working. They have insurance through their work. They're turning 65, and they're asking you the question: should I take Medicare or should I keep it through my work? And that's where we as agents come in and we begin to educate them about what their options are. And we want to sit them down and say, look, you have the option. You can keep your insurance through your work, or you can take Medicare. I'm glad you reached out to me. Let's sit down and have a conversation and really break it down and see what's going to make the most sense. So we call that a cost analysis. Is let's sit down, let's do a cost analysis and break down what's the monthly premium of your health insurance through your work versus what those costs are going to look like through Medicare. And then there are some additional questions. There's more information that you want to uncover within that conversation. Are there any dependents on your coverage? Are you carrying a spouse? Are there any children? Anybody that's on your insurance through your work? That's important information that you'll need to know. And if you are carrying any dependents, do they have any alternative health insurance options? But these are questions that we want to ask as agents. This is a part of the conversation that you want to have with your prospect. And then a lot of times, an added question that you're going to get from your clients are, I don't want to get penalized. I keep hearing that there's some sort of penalty if I don't take Medicare. So I need to figure out what it is that I want to do. In a common misconception, a lot of people assume that if they take Medicare, that they have to take their Social Security benefits, their retirement benefits. I feel like that's a very common question that we get from a lot of the beneficiaries that we're meeting with is, well, I don't want to take Social Security. I want to keep working. I don't plan on retiring anytime soon, so I don't want to take Medicare. So for those reasons, I don't want to take Medicare. And we have to break it down and say, look, both Medicare and your retirement benefits are done through Social Security, but they operate completely independently from each other. So if you want to take Medicare, or let's explore the option of taking Medicare, doesn't mean that you have to take your retirement benefits. And we have to make it very clear to them, because I feel like most of the time people are saying, well, I don't want to take my Medicare because I'm not ready to take my retirement benefits.
Yeah. I think there's so much that goes into making that decision. I feel like that you if you're as a client, they owe themselves to use that time to really investigate with a licensed insurance agent to kind of help figure out what the right move is. There's various things that could be involved. I hate to say that there's just this yes or no answer, because there's other times also where it's like, yes, this makes sense to enroll into Medicare, but maybe not a Medicare Advantage plan, or there's just too much to it. Don't just leave it to be a yes or no answer.
Right. And it's absolutely worth having the conversation, for the beneficiary, because who knows, it could very well lead to them going ahead and taking Medicare and getting onto whether it's a Medicare supplement or a Medicare Advantage plan, and they could save a lot of money versus what they're paying through their health insurance. And the reality is sometimes you may discover that it makes more sense for them to keep their health insurance through their work, but that may not lead to a sale for you as the agent right then and there. But let me tell you, that is going to lead to referrals. And please understand that down the road, that is a sale that you've got in the pipeline. But if you're doing right by your customers and you're advising them properly on what's best for them and not what's best for you, and if that advice turns into, hey, right now it makes more sense for you to keep your health insurance through your work, let's go ahead and stay there. But if things change, maybe when open enrollment comes around and those prices go through the roof, or maybe your dependents that you're carrying now, maybe they take a job where they can get off of your insurance and get onto an insurance that's offered through their work. So situations change. So don't just assume that, hey, I've got to wait until they retire and that's when I'm going to be able to cross that Medicare bridge with them. Circumstances can change, something could change in 6 months months or over the next year. So you want to make sure to let them know that, because if you don't tell them, if you leave that out of the conversation and say, then it could be a missed opportunity. You want to say, look, when open enrollment comes around, if those prices go up, or if the benefits are changing to where it's just you've got this outrageous deductible, then let's sit down, let's have a conversation again, because you can leave your group insurance at any time throughout the year. You don't have to wait until your company's open enrollment to get off of your group insurance. You can take it if it's like what would be.
Some of them won't just allow you to remove yourself from
the group plan.
Right.
Yeah.
Yeah, like some of them you have to wait till open enrollment.
Until the open enrollment.
Yeah. There, it just depends. And again, like it's not all like one size fits all. It's there's so many different scenarios, and you have to kind of get to know each plan, because some of them you do have to wait until like November or whatever it is to be able to disenroll yourself. So. Yeah.
And again, I just want to drive home the point of look how much time we spent on this one question, breaking it down, just because it can go in so many different directions that you can't just Google this answer. It's not going to be like on a PowerPoint presentation. This is something that you want to have a conversation about and talk through it, because
a lot of it comes with that experience, right? But this is what our hope is with doing shows like this. We're hoping that this will be like you gaining more experience. That's why we encourage people, listen to the show, share it with other agents, because you are getting a step further. It's like every time that you listen to the show, and every time that we're having discussions about Medicare plans and decisions, you are getting a step further as an experienced agent. So and that could be even if you're like a year in, 2 years in, 6 months in, or 5 years in, there's something that you can learn from these conversations. I really believe that. Hey, I didn't even talk to you about this question because it came up to me while we were having our conversation, but it's there's this question that I've been seeing a lot, where there's a Facebook post out there that's being shared a lot of times by nurses and even doctors that says it's warning people about getting on a Medicare Advantage plan. It says it's a bad move. Do not get on a plan, without a whole bunch more, without much more to say. And it's just like, warning, do not get yourself on an Advantage plan. You're hurting your ability to get your care. It's a bad decision. How can I respond to a client that says that? How can I respond in that situation? So I'm gonna go ahead and throw it at you to start, and then I'll jump in.
Yeah, I've seen it. I've seen that, especially in rural areas, in these smaller towns, because many times I feel like it comes down to the hospital just doesn't want to contract with some of these Medicare Advantage carriers. Reasons we won't dive into the reasons behind that, but many times, and so they'll put out those ads, or they'll give this information, or even at doctors' offices say you cannot be on this plan, or make sure that whatever you do not get a Medicare Advantage plan. And I can't get on board with that, because if you've got a hospital, or if you've got a doctor that's advising you, or a doctor's office that's advising you to just stick with original Medicare, that could lead to some huge financial problems, because understand, Medicare does not have a maximum, original Medicare does not have a maximum out-of-pocket limit. So if everything may be fine if you're just going through your routine care and receiving the routine services, but if you end up in a situation where maybe there's an accident, or you come down with a serious illness that's going to lead to some surgeries, or the recovery is going to be lengthy, then you're kind of opening up the gate. You're exposing yourself financially, because you're going to incur a lot of medical expenses while you're trying to overcome whatever the situation may be.
Yeah, I think there could also be more to that. It's not always just in rural areas. There are a lot of doctors, even here. We live in a city. We're in San Antonio, Texas, and go Spurs, go! Sorry, but we live in San Antonio, Texas, and so in San Antonio, I would say that it's one of, like, Medicare Advantage is a very, very strong option, and still you'll see doctors that are encouraging people not to get on these plans. And I think that there's more to it. in a lot of times it's extra work for those doctors. So if you're a primary care doctor, then you have to have someone full-time who's doing referrals, because otherwise they take forever. If you're a specialist, sometimes you're frustrated because you're waiting for them. And then sometimes we were talking to someone earlier today who works in billing for one of the hospital groups, and he's like, oh man, it's cumbersome. It's like, they have so many stops in place to not pay, and it's frustrating, and you have to jump through this hoop and that hoop to get to it. So I do think that there is some truth to it. It's not just like, oh, we just don't like Advantage plans. So the way that I probably would respond to this, and again, like you said, like if you're in a rural area, it's probably a different situation. But if you're in an Advantage market where Advantage plans do a good job, I would always have a conversation and say, hey, look, really it comes down to what's best for you, right? Whatever the option is that makes the most sense for you. I imagine that if you had the income of a doctor, you probably might make choices based differently than someone who's on a fixed income like yourself, right? So I can understand sometimes the doctors, because they're seeing things through the lens of being a lot of times millionaires, right? Like they're seeing things through that lens. And so sometimes they're going to give you advice on what they would do. Yeah. Like if you're making $700,000 a year, it's very easy to say, yeah, I would go with an Advantage. I mean, a Medicare supplement. But if you're on a fixed income, sometimes what makes the most sense for you might be a little bit more work for your doctor. And if it was me, I might be okay with them having a little bit more work, but ultimately it's up to you and whatever you decide. If they take the plan, that means they might not just prefer it, but I want to encourage you to make the decision that's best for you in your financial situation. Man, it's such a frustration of mine, and so I get heated about it because it's true. Like, their financial situation is different than a senior who is retiring. And it's always a big frustration of mine when I hear, especially someone who lives in a low income area, who's clearly low income, and the doctors are serving a low income area. And it makes me very upset when I hear they're like, stay away from HMOs, stay away from them. Like, okay, how about, they're like, my doctor says never. I was like, well, one of our agents, he always would say like, okay, no, I understand you really like them. If a financial situation were to come up and it got really expensive, do you think the doctor might help you with those bills? Because they're not. And so like, it's always a frustration of mine, but I understand what their issue is. Like it does make it harder, but all of those things, those sacrifices that people are making end up paying off for that client. It saves them a lot of money in the long run. And so I'm okay with them having a little extra work so that way this client can eat better.
Yeah. I mean, I when I'm sitting with clients, I said, look, you've got to be selfish in this decision-making process. And you have to think about what's best for me in this situation, not what's best for the people that I'm hearing this and I'm hearing that in all these different places. You've got to figure out what makes the most sense for you and be selfish in that decision-making process. And so again, it's going to be you who, if you end up with any bills, it's you that's going to be responsible for paying these bills. So you got to think about these things when if these situations do come up.
Yeah. Also, I really like doctors and I really like rich people. Like, I don't have any problem with them, being in that financial situation. I'm just saying like, hey, don't let them give you insurance advice, right? And I won't give them medical advice.
Yeah, and again, we're just working off of this scenario, right? But we're not here saying, look, it's got to be an HMO plan or it's got to be a Medicare supplement or a PPO. What it's got to be is it's got to be a conversation with your client where you educate them about the different options that they have and understand their particular situation, financial situation, health status, and then helping them make a decision and kind of making that decision together with your client and just making sure that they understand all the options that are on the table for them.
Yeah. And I think for a lot of people, a Medicare supplement does make a lot of sense. But I also think clearly for 50% of the population at this point, an Advantage plan makes sense. Mm-hmm. So, hey, let's move on to the next question. Did you have another one we were going to jump into before?
Yeah, I feel like this is a super common question that we get from a lot of our clients these days. And so I'll go ahead and read it out. Your client calls you and tells you that they keep getting phone calls and mail about qualifying for thousands of dollars in grocery benefits. So how would you respond to that phone call? And so first off, the first thing that I do is I say, hey, look, thank you so much for calling me. and not the phone number on that postcard, or thanks for not, responding to these phone calls that you're getting or whatnot. I appreciate you taking the time to reach out to me so that we can talk through this. And so a lot of times some of these plans, they're advertising $2,000 or $3,000. I've seen, in the $2,000 or $3,000. And I start thinking about, well, the market that we're in, I don't know that there's a plan out there that offers you that much money in a grocery benefit. But what I will say is I'll tell my clients, look, there are plans out there that offer grocery benefits. And at this point, you know your client's situation, whether or not they qualify for some of these grocery benefits, or maybe they're already on a plan that offers the grocery benefit, and you know how much of a benefit they're getting, and they're wondering, well, I only get $50 a month for groceries, but I'm looking at this advertisement that says I can get $2,000 in grocery benefits. I'd like to see if I qualify for this one. And so I say, look, the way I look at these are advertisements. And so a lot of times they're going to advertise the maximum amount that one can qualify you, but what they're qualify for, but what they're not telling you is that you have to meet certain, criteria. You have to qualify for
the SSBCI, or is that what you're referring to?
Yeah, no, not even necessarily that. I mean, that's a part of it, but even just Medicare Advantage plans that are offering these.
Yeah, no, and I know that with, and sometimes people don't always follow these rules, but beginning in 2024, you can't advertise because before it was problematic because, the Joe Namath commercials, and every time, so if you've been doing this for a while, and every time you hear the word Joe Namath, people are just like, kind of mad. So, but with the Joe Namath commercials, they were kind of saying you could get up to $5,000 back every year. And so when people would hear that, they'd call you. They're not doing it the same way that they were doing it before. So there is a lot less of it. And so, however, there are sometimes and you're seeing it less and less where they're advertising the specific dollar amounts, because every one of these commercials now has to be approved by CMS. And so sometimes you'll see kind of like the lower level ones, people are still getting them through, but it's less of it. So a lot of times maybe the way that I might approach that conversation is, there is that plan available, and just thank you so much. I remember that I've told you that make me your first call and I can explain it all. So this particular plan that they were advertising is this, such and such, and it may have a smaller network. If you're okay with that, we could definitely take a look at it. Are you okay going? And maybe possibly if you had to lose your doctor, we can look at that. But sometimes we might have to make sacrifices to kind of get that extra coverage. Is that something you want to do?
Or it could be a DSNP ad where that dollar amount that's being advertised is for a person who's a dual eligible, and the client that's calling you, isn't. Because again, through the training and everything that you're receiving, finding out whether a client is DSNP eligible or not should be a part of your process. And so when this client calls you and they're inquiring about this high dollar amount, it's that advertisement is for a DSNP, but you already know that your client does not qualify for Medicaid. And so you say, hey, look, that ad that you're seeing there, it is an option that's out there, and you may run into people who have that big grocery benefit, but that benefit is for people who have both Medicare and Medicaid. And I know you and I, when we met, we sat down and we talked to see if you might qualify for both Medicare and Medicaid, but your retirement, income alone puts you over the limits for Medicaid. So unfortunately, you don't qualify.
I might ask him, has anything changed with that, by the way? Like I know that we had talked about it, but just out of curiosity, have you had any changes to your finances that might qualify you for that? Mm-hmm. That, or there's just things like that, and still kind of leave it to questions and not make an assumption, right? Like, hey, did anything change, or so might do that.
Yeah, what you don't want to do is say, no, you don't qualify for that benefit, so don't worry about it. Just throw that in the trash. Yeah, or don't call that number. Yeah. Like, that's still going to kind of leave them with that itch of, well, I want to know, and I wasn't really happy with the answer that my agent gave me. So take the time to have that conversation, to re-explain, even though you may have already explained it. And like you said, open up a conversation, ask some questions, and see if maybe now they do qualify. And so that way you've done your due diligence with them and said, okay, well, it doesn't look like that's going to be a good fit, or the plan that you're on is still the right fit for you. But let's talk when open enrollment comes around, and we can see what new options might be available to you.
And if I had some time open, I might be like, hey, would you want me to drop by just to kind of show you what they were talking about in person, that kind of thing. If I have some time, so everybody's situation is different. Some people do phone sales. If it were me, we're mostly, like most of our agents do a lot more local sales. If it were me, I would probably just say, hey, I would love to drop by. It's always a good thing for that relationship, right?
And I love that because, again, anybody who's listening, if you're a very busy agent, you've been doing this a long time, or you've got a larger book of business, maybe you may not have the time to do that. But if you're newer to the business, or you're listening because you're trying to figure out ways on how you can grow your book of business because you don't have such a big book of business yet, then you want to take the time and say, hey, look, you know what? I'm actually open, tomorrow or later this week. Let me come over and let's sit down and let's talk about it. And that's going to lead to that retention, and it's going to strengthen your relationship with that member. But at the end of it all, it's going to lead to referrals, and you can ask for referrals. They're going to say, gosh, I love Raul. I love the fact that he came over and went through all of this with me and took the time to explain that to me. So the next time that they're out with their friends or family members and the second insurance comes up, they're probably going to be more likely to say, why don't you give Raul a call? Why don't you reach out to him? He's my guy. He actually took the time to come over and explain some of this stuff to me. And when I wasn't understanding, he came over again and helped it. Now, of course, as you grow your book of business, you may not have as much free time to be able to do that. But I do believe that is when you're getting started, when you're in the beginning stages of your Medicare journey, I think this could be a good piece to help you grow that book of business.
Yep. Let's go on to the next question. I have a client who's been prescribed a new medication that's not covered by their current Medicare Part D plan. They're worried about the cost. What steps can I help to take to help them find a new plan? So the first thing is if you have a client that gives you a call and they say, my medication's not covered, I need to find a plan that covers it. I might take a break right there and say, hey, look, what's the medication? And then you find out what it is. If it's something like Ozempic, then that's easy, right? What's the rule with Ozempic?
It's covered by your prescription drug plan if it is prescribed for diabetes.
For diabetes, if it's diabetes related. And so right now it's the magic drug that's a weight loss drug, right? So you're seeing that. And so find out what it is before you start looking at changing the plans, right? Because it could be something like, hey, look, I'm gonna be real honest with you. We could change you to any plan, but when it comes to Ozempic, we're not going to be able to get that covered regardless of the plan that we put you on. So then if it turns out, no, it's something else that is covered by other plans, what I might do, depending on what time of year it is. So if it's open enrollment, let's go ahead and get you changed over. If it's OEP, right, January through March 31st, let me come over there. We'll take a look and we'll get you switched over. But if it is in the middle of August, where we're at right now, and you get that phone call, then you would be able to go ahead and help them to talk to their doctor and say, hey, look, let your doctor know that they can send in a request to I can't remember the name of it. What it's called? Pre-authorization or prior authorization, something like there's ways to get
formulary
them to
exception
of the formulary, whatever it is, and get them to review that. And see if, since that medication is the only one that's going to work for them, maybe they want them to try another medication first or whatever that is, but it can go back to the doctor. It's not over just because you go to the pharmacy once and you're told no. So maybe have that conversation with them, coach them through that. And then from there, let them know what the enrollment periods are, see if they maybe have an enrollment period available. And if not, explain that, come October, I want you to know you'll be my first call. We'll schedule an appointment and we'll get that taken care of.
Yeah. And there will be times where you may not be able to do anything for your client, but you do want to tell them, look, it's going to be a conversation for you to go back and have with your doctor and see if they can help you with a formulary exception, or maybe they might have some samples to get you through if you're trying to figure, maybe it's a new medication, like you said, and it's August now, and this is a new med that your doctor really wants you to take. See if, and your current plan does not cover it after you've discovered that. That's step one, right? Let's check on our end and see if it's covered or not. But if it's not, and it's a new medication that they're being prescribed, we'll say, look, let's see if your doctor can get you some samples, because right now your plan doesn't cover it. Open enrollment's around the corner. We can find you a plan that is going to cover it. Sometimes pharmacies offer coupons, or there's discounts available, or even the manufacturer may offer some discounts. That's not always the case, but again, these are options that you want to be able to throw at your client to help them kind of resolve this problem, because the reality is we're not always going to be able to have that solution or find that solution for them on our end.
Yeah, absolutely. Hey, that's all I have on this one. Do you have anything else on it?
No, that's it.
Well, that's our time for today. I was just looking at the time. I think we continue to do these, and I really feel like it's going to help. If you're an agent, it's going to help you get to that next level. And so we'll continue to do them. If you have any other questions that you would like us to kind of jump on, we're happy to look at that. Don't hesitate to reach out to us on social media. We're there on YouTube, on Instagram, TikTok, and Facebook. So don't hesitate to reach out. So until next time, keep getting out there. We're getting ready for AEP. Get prepared, get ready. It's going to be a good one.